for 9 years now, and what it means we is actually 25 organizations in health innovation come together. Each makes a donation, a charitable donation, and we also sell tickets. They're all donations. In this case, to the North Texas Food Bank and to military families that have returned to support military families through the George Bush Institute. So these worthy causes are supported. This is a very special time of the year for us to get together, and any organization that sponsors this is a co-host of this celebration. It's a really fun event, very different from the ones that we do to, be proud of ourselves. We're proud of the whole community on that day, and together we give back to the people. Some initiative that we started this year, led by Java Castellanos, who runs the Venture Center for us, is we have now facilitated 58 meetings between venture capitalists and startups. Over 80 venture capitalists are in this alliance that we've built over 8 years, and they take office hours with our startups, but not just with our startups, with any startup that wants to sign up for this free service. This is a community service, the like of which is supported by the sponsors that I just showed you. We have facilitated, we have over 80, I think it's 85 startups signed up. Again, any startup from anywhere. In most cases, it'll be a North Texas startup. In most cases, it'll be a health-related one. It has to be pretty much somehow touch healthcare. And, but it doesn't exclude anyone. So the beauty here is we're creating connections and making things happen, and it's a net win. If you haven't seen it yet, it's part of our expansion. The first day of 4 offices, that's the Venture Center, that's where these things happen. And believe it or not, this is new for our region. We just haven't had anything like this here. So it's a great pleasure to do this for anyone, regardless of who they are, and support health innovation all together. Our addition also brought us new tenants. These are the companies that are residents here with us. Actually, all but one of those offices in the new extension are leased. So we opened it in July, so this is super fast. But these are the good companies that have joined us since then, and we're looking forward to have many more join us throughout the years. Another initiative that has grown in the past year is the WISH initiative, Women in Science and Healthcare. And this network now touches 7 college and university campuses in and around Dallas-Fort Worth. What that means is, just as you know, when you were a student, you always hear about the academic pursuit of everything. Well, we're bringing entrepreneurial alternatives to young women that want to know more about that. We need more women in entrepreneurship. Most of the healthcare is delivered by women. And so this has been a great success, supported by a couple of SBA grants. Javan has led that initiative, and now we're handing it over to these college campuses, meaning that there are groups on each of these campuses that are pushing it forward on their own with our more softer support. And lastly, we are proud to announce again that the Texas Healthcare Challenge Edition 8 for 2026 will take place, I think it's March, anyway, early in 2026 with the support of our presenting sponsor, Texas Health Resources. This was a great success. Again, this year, this is the 7th hackathon. Over 1,000 people have participated in these hackathons. Over $1 million of cash and in-kind prizes have been dispersed to 118 hackathon winners over the years. And the ideas generated are over 1,000. So actually, several startups that we ended up backing have gone initially through a hackathon, which is just a weekend where people get together and work on healthcare problems. Ideas get spun out, and those become startups. Now, our startups that we have taken on did not come out of our own hackathons. They came out of hackathons elsewhere in the world. That's okay. We love it, and we know that eventually some startups will be started as a result of our hackathons as well, and create something great that alleviates human suffering somewhere else in the world. So it's a wonderful thing that Texas Health Resources is underwriting. So now it's my pleasure to introduce Maria Sierra from Harmonic. You have to imagine, unfortunately, music. So this is a great walk-on music that everyone. I had a great walk-on music too. It was Rock Me Amadeus, so some of you heard of that. So that was mine. But nevertheless, let's have Mario walk up here and give him a great round of applause. And let's kick it off.
Music. All right. Hello, everybody. My name is Mario Sierra. I'm the founder and CEO of Harmonic Biosciences. I wanted to tell you a little bit about the personal story, the personal why I founded the company. So my mom battled with endometriosis for about 7 years before conceiving my older sister. 3 years later came me. I got to see history repeat itself firsthand with my own sister and her fertility journey, and was so grateful to have my baby nephew Enzo. He just turned 1 year old. But what was missing in both of their stories was continuous real-time data for hormones to get insights into their body on what was going on. And so at Harmonic, we're pioneering the world's first continuous hormone monitoring device and bringing hormone health into the 21st century. A little bit about the market. So there's 170 million women in the US playing hormone roulette. Our device is targeted at fertility and menopause, solving key issues in both of these markets. On the fertility side, it's becoming very crowded. There's only 1,700 reproductive endocrinologists in the US and 480 fertility clinics. Once you actually get into that ecosphere, it's 3.2 years to get to a diagnosis. And once you get to IVF, it's greater than a 50% failure rate. In my estimation, that's due to a lack of data. On the menopause side, around 80% of diagnoses are missed. These women are going from doctor to doctor to doctor, getting the same test over and over, and they're missing the dynamics of hormones. So we're solving that problem and going to reduce the suffering in total. So this is the device that we're bringing to market. It's very similar to a glucose monitor. Glucose monitors revolutionized diabetes care. We're going to do the same thing in hormone health. It's a microneedle-based sensor. It measures your interstitial fluid. We're targeting 3 key hormones: estrogen, testosterone, and cortisol. Measuring 24 hours. There's a live symptom tracker for the patient and an actionable data feed. This is what that looks like. So patient is receiving direct hormone concentrations with graphs and trends over time. And they can input sleep, nutrition, and exercise to start correlating to those interventions. And for the physician, they're getting a live remote data feed that they can monitor their patient, optimize their treatment, and personalize their treatment for better outcomes. In terms of market sizing, we're looking at a $54 billion market between fertility and menopause. Key callouts being that 1 in 10 women experience infertility, and there's 1.3 million women entering menopause annually. Large markets. There's distinct ROI for each of the categories. So on the patient side, they're getting personalization and better outcomes. We're going to get to that number better than 50% with reduced burden and reduced cost. On the provider side, they're able to increase their volumes because this device reduces the burden on their clinic, and they can actually have further reach within their geographic area. On the payer side, as fertility becomes more of a reimbursed procedure, as outcomes get better, their costs go down. So I founded the company at the beginning of the year. We've got some great traction thus far, 6 LOIs across space healthcare, animal husbandry, nutrition, clinics outside of the US that want to use our technology, and some digital health platforms that want to leverage our data. Some industry recognition. We were able to pitch on the health stage in Las Vegas around 2 weeks ago, launched our fundraising round there, and IC3 earlier this year. We initiated the patent pending process through filing a provisional earlier this year as well, and we've been through 2 competitive accelerators. Our go-to-market strategy has a couple of different verticals. Consumer sales, so a device purchase plus a SaaS subscription model, similar to a Whoop or an Aura. Clinical rollouts, B2B2C, leveraging some of these telehealth clinics that are doing hormone therapy remotely. Data partnerships, like I mentioned, these digital health companies want to leverage our data to improve their algorithms, so licensing opportunity, and then strategic co-development into different indications in the future with some big pharma partners. So competitive landscape, you've got your behemoths on the far right, Dexcom, $30 billion market cap company, they're squarely in glucose. There's some other fertility companies in the space, different methodologies of testing, basically. You have temperature and light sensors, PPG sensing, and you have at-home testing. These at-home tests are metabolites of hormones. What we're bringing to market is direct hormone concentrations. I have a competitor in the UK, Level Zero. I think we can beat them in several of these categories, and we're racing to market. My background is in scaling startups. At Research Source, we did Class 2 and Class 3 medical device research in neurospine indications, worked a little bit at Whoop on the algorithm and validated ECG and blood pressure, and PrePilot is a software company in the clinical trial space, scaled that from 0 to 4 million. Got a great head of product through Jeanette in Rhode Island. My advisory board is stacked. Summer Maverick, twice exited founder, former VC, Robert Hodges, 38 years in med tech, and Courtney Doyle, leveraging her relationships with fertility clinics on the West Coast. Two doctors that want to use our technology today, and an interesting project. I had to shout out my intern, he's doing some great work. Our hardware development is going to be predominantly in the biosensor assay development phase for the first year. Hardware company developing our hardware initially with key regulatory milestones, and we're targeting Australia for our clinical trial. We're raising $3 million in a strategic round. And at the end of the day, what I want you to take away is that we're not just building another wearable, we're building a window into human biology and ushering in a new era of health, all while putting Texas on the biotech innovation map. So I hope you join us.
It's so fun to start his music. Hi, good evening. My name is Chris Klein. I am the CEO and co-founder of Pollen Sense. What is Pollen Sense? We are a patented deep tech air platform that will precisely identify the type of pollen, mold, and dust that you're breathing right now in real time. So we're a Series Seed company. We are already active in the B2B, B2G, and big data space, as you can see with one of our customers, NOAA. But why we do it is Moira. This is our end user, Billy. So Moira's son has an environmentally triggered illness, and they've never been able to find what's affecting him. They've gone to 12 doctors in Wisconsin, including children's, until they came to work with us. So this fall, we started working with Moira, and now she can find out real time with hourly spikes of what's triggering her son's reactions. There's a giant data gap globally. The real-time monitoring equipment that's on the market, or the manual collection, it's really vague or it's delayed data. Nothing is telling you what you're breathing right now, or they're literally just missing the what. This is the type of information that you see. This is what Moira was looking at to try to help her son. But what Pollen Sense delivers is real-time actionable data with hourly data, ground truth. We see a 69% missed fewer days for school, for asthma. There's a reduction in hospital visits due to asthma. This data is already being used to drive public policy, to improve public health outcomes. Our app, it helps you plan your day right now. We're already driving research and innovation, and we support climate and environmental initiatives as well. We have 6 patents with 2 extensions, and we have a full proprietary AI training platform. What that means is that we can take a particular particle, or a researcher around the world can take a particle and train it with our AI training platform, build that data set, and then start to monitor for that. So we're deployed across 26 countries already. We can identify things like pet dander, smoke ash, microplastics, even asbestos and silica. And you can see the spike. That's what Moira couldn't catch before because the daily average is so low. We also model data with a geospatial emissions model and license that to customers like Microsoft. We are tackling a large market globally for outdoor air data as our first market. Our primary beachhead, though, is hyper-focused in the United States or North America for outdoor air. We are a hardware-enabled SaaS model, so we have an annual license. We also license our data, so API, and then have an allergy app with a freemium all the way to a paid wall. The customer logos that you see there are paying customers already with us. We've sold into 26 countries, over 350 sensors, and we have more than doubled. By the end of the year, we will more than double last year's revenue. So we will hit 1 million or just a little over 1 million for the first time. And what we need, one of our focuses, when we look at our US market of where the sensors are located, we need less than 100 to blanket the country. That's phase 1, but you'll see in just a second that our COGS are really low, so we can make this happen. Competition has been people like the Weather Company. And right now we have an NDA with them, we're going into talks, and that's the Weather Channel, for those that don't know. We also work with Resometer. That's the team at Google that buys data from us. So competition has really changed. They're actually coming to us now to work with us. We have a great team. We're founded by 2 PhDs, aerobiology, ecology, and also a machine learning architectural expert and an allergy physician. And we have a mechanical engineer as well. Our COGS are 750 right now. At a higher volume, we'll be under 300. We have a 66% average margin, gross margin currently, and we have projections to reach 64 million before 2030 and have a 94% retention rate. We've raised almost 2 million to date. We are planning a Series C for 2026, and we have some milestones that we'll be meeting along that way. And I've already got 1.7 million in the pipeline leading into 2026. So I feel pretty good about hitting that target. We have a convertible note open right now for 500,000. That's to hit a couple of goals, and that's just a bridge to our strategic seed in 2026. But what I really want to end on is this. So this is just a snapshot of some of our global customers. Again, we are a global network, just really working to help vulnerable populations and bring that data. So I invite you to partner with us, join Pollen Sense in creating a healthier future and breathe easier together. Thank you.
Good evening, everybody. I'm Dave Townley. I'm the CEO of CellSense, where we are redefining precision dentistry. We're focused on dental implant and dental prosthetic markets. These are 2 of the fastest growing segments in all of healthcare. Unfortunately, millions of people are grinding their teeth at night. This is a really common condition. It's known as bruxism. It actually generates some of the highest mechanical forces in the body, and it destroys dental work. It is a complete blind spot clinically, professionally. Dentists cannot see these forces. They do not know who's grinding their teeth, and they can't preempt or predict any failures. And with 5 million dental implants being placed every year in the US, where patients are paying tens of thousands of dollars, this is a critical blind spot that we're addressing. And we have developed the Polaris platform to do just that. This is a technology that will make these invisible forces visible for the first time for the dental community. This is a clinical grade customized wearable. 4 sensors are embedded inside a smart splint that the patients wear, provides critical, actionable biomechanical data for the patients that the dentists are actually treating. So we have developed a 2-phased solution. Pre-treatment, our device is worn for 2 to 6 weeks by the patients at home. Our AI algorithm is generating a force heat map to give the dentist this critical missing layer of digital diagnostics so that they can engineer and design effective treatment plans for the patient's condition that's actually in front of them. But secondarily, post-treatment, our device tracks forces and long-term use to enhance long-term implant survival and ongoing splint compliance. With this type of total system approach, we can predict, prevent, and protect every implant for every patient. This is a really large market opportunity. We're targeting a $400 million segment, and with double-digit CAGR growth for implants and prosthetics, and unfortunately an acceleration in the underlying prevalence of bruxism due to anxiety, stress, and drug-induced factors. This market and this opportunity is exploding. We're not a concept, we're a regulated CE marked ISO 13485 entity. We have 510K pathway agreed and approved with the FDA, predicates and reference devices already known. We have a strong and growing IP portfolio. We've engaged a top-tier US firm, Brown Rudnick in Boston, to partner with us on this. Our coverage is much broader than the commercial embodiments that we're pursuing. We have 10 granted patents today, and we are a first mover in the space and have a powerful position. We've developed this from first principles. We have thousands of hours of bruxism data. We have engaged the community and are active in a live 5-site European evaluation right now. We have the KOLs in Europe and the community endorsing us. They're seeing this as the last missing piece in digital dentistry today. We've received great traction with premium DSOs in Europe. We've got LOIs for commercial pilot rollout. And the Zurich University, which is the premium dental university in Europe, we've completed pilot clinical evaluations and have an agreed clinical trial in place with them. 2 of the largest strategic dental entities are engaged with us right now on pilot data integration studies. We have a simple but very scalable go-to-market and business model. This is a B2B2C. We have very high gross margin. We've developed this from first principles, so the proprietary sensor and the supply chain is stable and is ours to control. We have a hardware-enabled SaaS platform, but critically, the hardware component is passed through and bundled to the patient. It creates frictionless adoption at dentist, DSO, and enterprise level. We are a first mover in this space. We do not have any direct line competitors. The competing entities predominantly have been focused on facial muscular activation or passive splint compliance chips. So our positioning here of providing actionable biomechanical data is a new category in digital diagnostics, and that's what we're protecting with our IP portfolio. We've developed this so it's a seamless fit into current modern digital workflows. Our team is experienced and strong. I have over 2 decades of medical device innovation and development. I've brought multiple products from concept to commercial success. Our CSO is a prosthodontist and leading authority in processing research, and our chair is a seasoned serial dental executive holding EVP and Chief Operating Officer positions at 3Shape and Eon Dental. The market is ready, the partners are ready. We're really excited to be bringing biomechanical insights to create a new foundation for precision dentistry. And we're initiating our Series A fundraising activity in Q1. We're raising 10 million so that we can refine our R&D, clear FDA approvals, and focus on commercial and clinical evaluations in the US. And we'd love for you to join us on our journey. Thank you.
Hello everyone, thank you very much for attending this event. I am Arvind, I'm the COO of Sequus Bio, a company where we developed a platform that can predict the behavior of cancer. There has been a lot of progress in the field of cancer therapy in the past few decades, but unfortunately cancer is still the 2nd leading cause of death in the United States. And you might be wondering why. The problem is the aggressive types of cancer. With aggressive cancers, you will have high mortality rates because you don't have the luxury of time. When a cancer is aggressive, you will have to immediately determine the behavior of cancer and immediately put the patient on the right type of treatment. But unfortunately, currently, we cannot do that. Determining the behavior of cancer is very, very patient-specific. It takes around 3 to 5 months for the oncologist to determine the first line of treatment. And to make matter even worse, the current clinical methods for predicting cancer outcome, they're only 50% of times correct. It feels like we're flying blind in the most critical times of cancer care. This is why we developed Sequus One. Sequus One is a platform that can predict the behavior of cancer and can predict the response of specific tumors to different types of therapies that we have in the clinics. The way it works is that we'll get the needle biopsies from the patient's tumor. These are actual cells directly from patient's tumor. And using the unique and personalized data that they can give us, we can create a digital twin of the tumor. And we are using advanced AI algorithms and quantum computing algorithms to do so. And we can achieve it in only 5 days. So Sequus One can act as a decision support tool for the oncologist so that they can put the patient on the right type of treatment as soon as possible. In order to show you what Sequus One can do, we're bringing you an actual case study. This is an actual patient, a 39-year-old patient with triple-negative breast cancer, a type of aggressive cancer. Using the current risk assessment report, a report could be generated in 3 to 5 weeks. But Sequus One could do it in only 5 days, with better accuracy. So if you compare Sequus One to other types of reports that are out there, we can predict and generate a report in a shorter amount of time, with better accuracy, and for cheaper. In terms of milestone and pipelines, we already have a patent for the algorithms that we use for creating the digital twin. And the first indication, the first disease that we're tackling is breast cancer. We have already started our first pilot study with breast cancer patients in collaboration with UMass Medical School and Collaborative Cancer Care. In the next 12 months, we are going to run our pilot study, gather all of the data that we can, and further fine-tune our platform. And we're planning to also submit our 510(k) application for FDA approval. In the next 18 months, we are going to expand our collaboration with other cancer centers in the United States, and also expand our indications and work on different types of aggressive cancers, including melanoma and lung cancer. We are fortunate to have a brilliant team in Sequus Bio. Our CEO, Ashkan, he is a cancer biologist. He has been working in the field of cancer biology and with cancer patients for more than a decade. I have been working in the field of cancer therapeutics for more than a decade. Dr. Metcalf, our CMO, she is the head of oncology section at Trinity Health Hospitals, which is a network of more than 100 hospitals in the United States. Dr. Zhang Gui, our Chief AI Officer, he has been working with bioinformatics and AI algorithms for more than 15 years. And Amir here is helping us as a bioinformatician, and he's one of the young talents here at Texas. And of course, we have advisors that help us as well. We are closing our pre-seed round for $750,000. These are some of the companies that have comparable products as us, software as a medical device, and these are the ROIs that they were able to generate. We are in collaboration with UMass Medical School, Collaborative Cancer Care. Google and IBM are helping us with running our quantum computing algorithms, and we are in collaboration with National Cancer Institute of Japan. Thank you very much for your attendance. If you're interested and if you are in the field, please come and ask us about the platform and the demo that we have, and we'll be more than happy to share it with you and tell you how it works. Thank you very much.
Hello everybody, my name is Pietro and I'm the co-founder of Whoosh. Whoosh is a femtech startup working on the first wearables that will take care of women's wellness. And I will tell you why. But let me start with the problem we are trying to solve. 85% of women suffer of similar diseases caused by wearing high heels for a long time. You can see some of them here, but one of the most important and most silent are varicose vein and the cardiovascular diseases associated. And the funny thing is that there is a $10 billion industry that is trying to fix those problems with clinical treatments. Well, our idea is very simple, put that industry into issue. But first of all, we started from a scientific perspective. This is a lab-to-market project based on 15 years of research. Professor Jack Hirsch and his team and several papers basically stating that neuromuscular electrical stimulation applied to food could increase blood speed. In other words, activate your microcirculation. That's why we have created the first 3D printed insole with neuromuscular electrical stimulation integrated. everything controlled by AI through an IoT card in your smartphone that can provide the treatment how long and when you need it. This is a working product, and you can see here or over there. And this is how it works. Basically, the electrodes that you can see inside the shoe will be controlled by IoT card and will activate your muscles. The muscles will compress the vein, and so the blood will be pumped up, and you will avoid blood stagnation and activate your microcirculation, as I said. Our USP is very important. We want to connect wellness, luxury, and technology into a unique amazing product, let's say in a single step. And the market opportunities are huge. We're talking about 145 billions. This is the entire footwear market. As we come to high heels, we're talking about 7 billions, and we aim to get 1% of this market in 3 years. To give you some more data, in the US there are 56 million women wearing heels for their job. Only in Texas, the estimation 200,000 every day wearing heels for their job. Competitors, of course, we have in the luxury industry, in the healthy industry, but no one of them is using NMS, electrical stimulation, integrated in their products. The business model, very simple, B2C, with our premium price product on a high level, and then we would like to be a B2B model, selling our technology and installs in order to scale, because we are a tech company. The execution, we think we have the right team for the best execution. Ellen and Jana, my co-founders, they both have a story in shoes entrepreneurship, and they both are women in business, one in a bank, the other one in real estate. Jack is our scientific advisor, and me with over 15 years of experience in entrepreneurship, technology, startups. I made 3 startups. The one was an exit, the second one scaling up, and the third is the current one. Our roadmap, very important, 2023, our first POC, incorporating the company in Dubai. 2024, the first MVP, being part of the Fashion Tech Accelerator in Italy, backed by CP Venture Capital, and they invested a pre-seed investment of $200,000. And now 2025, other important achievements like being here at Wildcatters and also winning the Luxury Summit in Geneva as best product in wellness and beauty, very important for us. 2026, our road to market. Revenue stream, these are the projections. As you can see, we start with luxury, and then we will add also the other industries, aviation, medical shoes, work, and then sport. And this is what we're looking for. 1 million that we want to invest in trials, product, team, and marketing. One more thing before to end. Here in Dallas, the couple of months I spent here in Dallas, we understood and talked with a lot of investors, professionals in the health tech space here in Texas, and we understood and discovered a new market, a new addressable market, nurses. So we decided to create a prototype, and this is how the prototype will look like. This is a clear example of how fashion tech could bridge and mix health tech into a unique, amazing product. So I hope that you enjoy our story, but most of all, I hope that you enjoy our story. Thank you so much.
Hello, I am Tracy Berwick. I am the co-founder and COO of Precision Health TPA. And I am here to tell you how we can radically impact the cost and quality of healthcare in the self-insured, otherwise known as the employer-funded market. Employer healthcare is out of control, and we can bring it back. We can offer 20 to 25% on average savings. We can provide better benefits by inserting innovation similar to what has been distributed in the Health Wildcatter 13 years of cohorts, as well as build in higher quality things. We can return ROI within 90 days. As you can see, healthcare costs are skyrocketing, while the benefits associated are plummeting. Premiums are up double digits every year. And you have to remember carriers profit as costs increase. In fact, healthcare is outpacing payroll, soon to be employers' #1 expense. One of the problems is the market has been consolidated to 4 primary carriers. For those in the healthcare space, we call them the BUCAs. That's Blue Cross Blue Shield, United Healthcare, and Cigna and Aetna. Each of them own 2,500 plus subsidiaries. They basically pay each other, the whole equation. Actually, their internal transfers amount to about 1% of GDP, if that tells you anything. The precision health model is completely different. We put together custom plans that fit the populations that we're covering. We do that for a flat fee that can easily be budgeted by the employer. And one of the most important things, the employer legally owns their data, their claims data, which is information that they should be analyzing from an analytical basis that allows them to take action. We actually provide them with a report card along with real-time access to their data, so they know on a monthly basis how their health plan is trending. The momentum is there. It is shifting. 65% of employers have moved to self-funded, and over 90% of Fortune 500 companies. Unfortunately, you're seeing the TPAs go and buy, or the carriers go up and buy the TPAs, creating a conflict of interest and really not the reason that people move to self-funded to start out with. Our competition, the other TPAs in the market today, their business models are marking up point solutions, creating spreads, taking percentages of savings. We don't work that way. It's completely transparent, everything that we do, because we're the first fiduciary TPA to come to the market, and we're legally bound to do that. There are also too many layers in the process. There are a lot of people being paid that are bringing absolutely no value. You listen to statistics from hospitals to health carriers, almost 70% of the employees are administrative. We cut that down to what really matters. We're working with the employee, the employer, and the provider, the way healthcare should be. We design high-performance health plans. We're able to build in things like genomics, functional medicine, MSK, virtual alternatives, things that really help lower cost on some of the more higher cost claims for employers. Our operations, we're on the most modern technology. Everything is fully integrated. There's no fragmentation. And we use AI to allow the end user to be able to ask, think of the Alexa or Siri of healthcare. They can ask anything about the particular participant's healthcare, including their network or the procedures that they're going to have done, and they know that cost in advance of receiving that care. And once again, the performance reporting, as I said, as a fiduciary, we're legally bound to be illustrating the performance of the plan, so the employer is never caught off guard or not understanding how their plan's performing and able to take action for that. How are we different than your legacy TPA? Well, first of all, we pay claims faster and more accurately. We have an independent audit, so there is all of our due diligence is done from a fiduciary aspect. So there are no conflicts of interest. We have no entities in there that are having the fox guard the hen house. And the fees are completely transparent. There's no conflict of interest and complete transparency. We're able to reduce the average cost of healthcare for an employer by 23%. We're increasing the quality of the benefits that are provided to the employer by an average of 7%. And we're able to, the customer acquisition costs can be paid back within 6 months. The results you can see, measure, and scale. We are real. We have lots of LOIs and existing contracts. We've got 3.5 annual revenue in our pipeline today. We actually turned away 3 cases for 9/1. So funding will actually put us in a revenue generating position. And we're 85% there. We've been working on implementation alongside raising money. Our team is myself, who have started 7 companies, all still profitable. Craig Herndon, who's our strategy and growth officer, 15 plus years in networks and analytics, and Jennifer Stanley, who is an ERISA attorney who structured the ERISA backbone, or the fiduciary backbone of our company. We are raising $1 million on a safe with a 20% discount and an 8 million cap. We're using that money to turn on existing contracts for implementation, for team expansion, for compliance, sales and marketing, and working capital. If you remember anything about this presentation, I want you to remember that we can save employers money, we can provide them a better health plan, and we can mitigate their fiduciary responsibility and risk that's become greater every day. Thank you very much for this opportunity to present. If you've got any questions, my contact information is on the slide.
There's a great big beautiful tomorrow, lying at the end of every day. There's a great big...
Hello everybody, my name is Paul Evans and I'm the founder and CEO of Pathy Health. 10 years ago, my father was diagnosed with glioblastoma. It's terminal brain cancer with an average life expectancy of about 10 months. I became his advocate, helped him navigate the maze of fragmented records, endless phone calls and confusing reports, and fought to get him into a clinical trial. We were successful, and against all odds, he's alive today, 10 years later. Unfortunately, most patients don't have an advocate, and they don't have the knowledge and the resources to navigate a system that's already set up against them. And this matters because the problem is massive. Every year, there are 2 million new cancer diagnoses in the United States and 18 million patients who are undergoing treatment. These survivors manage records from over 5 different providers, which results in 80% of these records being fragmented and 25% containing errors and duplicates. This delays access to treatment almost 3 weeks, and these patients end up spending 15 to 20 hours a month chasing these records down. And essentially what we're saying is that patients who are fighting for their lives are also fighting for access to their own information. Pathy solves this with one secure, patient-controlled profile that aggregates and unifies all of their oncology records into one single source of truth. Our AI health advocate analyzes and explains labs, scans, and doctor's notes in plain language, 6th to 8th grade language, so patients understand their diagnosis. We match patients in real time to clinical trials right through their dashboard, and patients control who accesses their information. They can choose to share that information with an oncologist, with a caregiver, or they can opt in to be contacted by the trial sponsors who are managing the trials that they've matched to. On the other side, these trial sponsors and researchers get access to cleaner, real-time patient data to encourage better research and reduce costs. And this is how it works. So patient data flows through a FHIR-based access layer like our connection with Fasten Health. Fasten has connections with over 50,000 hospitals across the United States, which accounts for about 80% of the beds. Once we get that information, we structure it and build that patient's profile to give them a better understanding of their diagnosis and treatment. Now, the market globally is large, and here in the United States, there are around 6,000 oncology trials being run, recruiting hundreds of patients at about $5,000 each. That gives us an annual sort of recurring opportunity of about $5 billion, and over the course of the next 5 years, we expect to capture 2 to 5% of that, layered on top of real-world data licensing, which gives us an obtainable market of about $250 to $500 million. And this is how we make money. So we get paid every time a patient matches to a trial. Sponsors pay $3,000 to $10,000 per patient, depending on trial phase and the rarity of disease. And on the other end, pharma and research institutions license de-identified patient-consented data for oncology research, which creates recurring revenue through subscriptions and per data pull fees. We already have some great traction. So we're partnering with Fastend and Nexus MD to access patient records. We have 500 patients on the wait list, and our site just went live on Friday. We're working with the American Cancer Society's Patient Support Services, and we were approved as a scope in ARPA-H's CX Hub, which gives us access to government grants and opportunities. We're also working with JPS and UT Southwestern on the clinical research side, and we have our first client in Elevate Clinical Research to help them source patients for the trials they are running in the DFW and Houston areas. This is how we stack up in the market. So our competitors all touch a part of the problem, whether that's analytics, ownership, or access. They don't really focus on the entire patient journey. Pathy does. We're the first solution that empowers patients while delivering cleaner, real-time data to sponsors and providers. Our go-to-market is also straightforward. We go direct to patient where cancer patients are most active. 70% of cancer patients are active. They report daily activity in online forums and communities. This results in 23% higher compliance rates to treatment, and these are the patients we want. These are the patients that will become our ambassadors and really ignite that flywheel effect. Our team consists of healthcare, AI, product, and partnership experts, and we're supported by an incredible senior advisory team from places like Eli Lilly, AMRC, patient advocacy groups, and physician experts in the oncology space. We're currently raising a $500,000 pre-seed round, which will give us the opportunity to onboard 2,000 patients, execute partnerships, and generate between $1 and $1.5 million in revenue. So healthcare doesn't just need better technology, it needs better humanity. And Pathy combines both. AI-driven clarity with real human compassion. What started as my dad's fight for survival has become a passion and a mission to help other patients find their path to advocacy and understanding. Thank you.
Hello. At PowerSet, we're building smart insoles that go directly in your shoes, designed to support you whether you're an athlete or a patient. My name is Avinash Srinivasan, and I'm the founder and CEO of PowerSet. And I built this company because I lived with this problem firsthand. As a Division I athlete, I constantly watched my friends and teammates, some of the most disciplined people I know, get sidelined with preventable injuries. And when it happened to me, I realized it wasn't just bad luck, but the result of a systematic issue in the way we approach training itself, and one I knew how to solve. After the pandemic, balance-based training exploded. Running participation grew by nearly 40%, and strength training with free weights became the #2 global fitness trend. And while this brought millions of Americans to the gym chasing new fitness goals, it also sent over 35,000 to the emergency room that month alone. And it's because these movements are hard. A small shift in weight, a small error in your technique can lead to strains and injuries. And as these stack up over time, they lead to chronic issues and injuries with your body. And we see this all the time in the form of herniated disc, tendon stirs, tendonitis, and muscle tears. Even though 31% of all of those injuries are directly attributable to bad technique alone, people still benchmark their progress exclusively against metrics like reps, weights, miles, and pace, instead of measuring what matters most for staying safe. PowerSet adds this missing piece of training data by giving you objective proof of progress on your form so you can safely pursue your next fitness goal. Our solution is an insole sensor system that uses our sensor configuration to map the force distribution across your feet. To use it is simple. Simply take our insoles, put them in our shoes, connect to our app, and then start moving. And as you move, our precision sensors capture all of your ground force data in real time and then send it to our app, where we give you this information in 3 stages of feedback. First, as you're moving, you get live guidance in the form of visual heat maps and audio cues, helping to adjust your form in real time to prevent injuries before they even happen. Second, at the end of your workout, or at the end of your run, you get an AI-powered breakdown of your balance trends, your asymmetries, and compensations, so you know exactly where to look for to stay injury-free. Finally, all of your session data and all of your training data aggregates over time to give you objective proof of progress on your form, as well as generate structured training plans to improve that form over time. Now, you could hire a personal trainer to give you these types of insights, but for the vast majority of people, and even most pro athletes, it's simply unattainable to have one watch you 24/7. And compared to other smart insoles on the market that just give you general force trends, we deploy an AI trained on decades of rehabilitative and athletic data sets to give you actionable feedback that continues to improve as our user base grows. Now, the market for this type of movement intelligence is defined by the 120 million Americans doing these types of exercises. At just $150 per pair, this is a $24 billion annual opportunity. If we anchor it against Americans already buying similarly priced comparable sports equipment, this is around a $5.2 billion opportunity per year. We aim to capture around 0.2% of that market within the next 5 years, generating $12 million annually. But in order to get to market, we have to go through 3 phases of development. First, we've already been able to take our prototype to a beta, and over the course of this accelerator. And this right here marks the end of phase 1. And as we move into phase 2, we already have validation testing agreements with the University of Delaware, ACL and Research Tending Group, our university strength programs, multiple independent personal trainers and physical therapists, as well as a suite of consumer testers. And when we move into paid pilots afterwards, we already have agreements with big box gyms like Lifetime, multiple Blink Fitness locations, and Up Fitness Academy. And eventually, as we move into phase 3 and commercially launch early next year, we'll offer both our consumer package, which includes our smart insoles, as well as full app access, as well as a professional package aimed at trainers at clinics and gyms, that they'll get our app, a fully customized client dashboard, as well as the ability to distribute our insoles through client programs, as well as consignment sales. And with this strategy, we're going to create an early foundation by partnering with science-based influencers and affiliated gyms, and scale into retail alongside major sports brands, and eventually move our AI models to other balance-based movements like pickleball, tennis, and golf. This all sets the stage for our proprietary movement database by year 5, ready for licensing, acquisition, and ultimately partnerships. We know this road's going to be hard, and that's why we put together a team of medical professionals, experts in fitness technology and medical device manufacturing, and mentors at UTD and Brown University. And with their help, we've been able to win at our university competitions, raising enough money to take our idea to a prototype. And over the course of this accelerator, we've been able to take our prototype to a beta. And now we're raising $200,000 to activate our waiting partners and take our beta directly to the market by funding pilot enablement, validation testing, component costs, as well as initial production and launch costs. The fitness market is booming, but injuries are on the rise. Join us as we create not just our product, but reshape the future of intelligent training. Thank you.
We are going to help for many families, singles, couples to have a baby and be a family. My name is Eddie Paverov. I'm founder and CEO of Wildcatters company. We develop acoustic pulse technology for improving of women's fertility and improving of embryo condition for plantation via IVF. Now, infertility today is about 20% of women have difficulties to have pregnancy. So usually they're directed to IVF procedure, in vitro fertilization. Globally perform 2.5 million of IVF cycles. In the United States, it's 400,000 cycles. Every cycle costs about $50,000. No covering, insurance covering, it's out-of-pocket money. The average success of IVF is about 3 to 6 cycles for each woman. And one cycle is about 25 to 30% success. And it depends on woman's age. Now, Latica introduced acoustic pulse therapy, improved embryo implantation in IVF. It is non-invasive, painless, no side effects, streamlined treatment, only 3 minutes for one treatment. Regulatory fast, 510K, all the need. Competition, Latica technology provides 700 times more treatment tissue area. It is compared to existing technologies. No medical device used for fertility improvement today. So practically we are in blue ocean. IP. The technology protected by 3 patent families. It is 12 granted patents. Now, how it works? Biological effect. First of all, the cells release growth factors, VEGF, after the treatment. And the next stage is produce angiogenesis effect, producing of blood flow, blood vessels and arteries, a small one, of course. It's produced by triggering immune system, anti-inflammatory effect. It improves blood flow, circulation, local, and finally, we improve tissue rehabilitation from inflammation, damage, and other. Now, the result is that we have endometrial functionality improvement. We have uterine environment optimized, enhanced embryo implantation success. We have rehabilitation of inflammation damage. And finally, not less important, reduce pregnancy failure in the first 6 weeks of pregnancy. Now, how it started? We conducted a preclinical study on dairy cows. It's a large animal, large uterus, but we have very good success, 60%, so we hope human will be better. Latica biologic effect based on 7 preclinical studies publicated already, and on dairy other inflammations. And we have experience with 20 happy cows treated against mastitis. Our advisor is Professor Shlomo Mashiach. He's a world pioneer of IVF treatments. In 1982, he performed the 5th case in Israel. We have a partnership with Bnei Zion Hospital in Israel. They also funded the clinical trial. Now, we have agreement with the Austrian IVF Center in Vienna, with the Graz University cooperation. Also, we're going to perform clinical study there. And we have cooperation with a German company for business development, investment, and regulatory support for German-speaking countries. Now, business model. We're going to charge $1,000 for each IVF cycle. And you can see that 400,000 cycles, it produces $4 billion market only in the USA. Now, the roadmap, we're going to be starting now clinical trial in Israel. We're going to complete it in middle of 2026, and end of 2026 complete of European study, and 2028 we will complete FDA trials. So I hope to see you in our family. Thank you for attention. Have a nice evening.
Hi, my name is Don Tickey and I'm CEO of Pump and Heart. So our aim is to treat the world's single greatest unmet medical need in cardiovascular disease, and that's heart failure with preserved ejection fraction, or HFpEF as it's known for short. Advanced stage HFpEF patients present as breathless, even at rest. Their hearts are unable to function properly because of elevated cardiac pressure, specifically left atrial pressures, which result from stiff heart walls caused by chronic hypertension or high blood pressure. And this itself is a result of aging, because blood pressure goes up as you get older, but also comorbidities like diabetes, obesity, and for example, renal disease. These patients at an advanced stage face a very grim and miserable prognosis. They're mostly women, because there are twice as many women that suffer from HFpEF compared to men. And they will spend the remainder of their lives immobile and breathless, frequently hospitalized for long periods. Many will die in hospital. Clinicians are for a long time frustrated because they know that a reduction in left atrial pressure by just 3 to 5 millimeters of mercury is going to yield therapeutic benefit. They don't see any therapies making good progress in this space. A common form HFpEF, that is, it presents in basically either early stage or late stage, but it presents in very small numbers at an early stage. These patients are asymptomatic. They don't know they have the disease, so the clinicians rarely see them. If they do see them, there are some therapies to mitigate the onset of late stage HFpEF, but once late stage HFpEF happens, then there's nothing available to them. We aim to be the first effective treatment for advanced stage HFpEF that extends life significantly. And the market is huge. There are over 2 million patients in the US, Canada, and Europe with advanced stage HFpEF. And our research concludes a device at a $50,000 price point would treat 1/3 of these patients. That's a $32 billion total addressable market. So what is it that we're developing? Well, it's a tiny pump implanted in the left ventricle on the left side of the heart that draws just enough blood during the resting phase of the cardiac cycle to relieve those elevated pressures, ease congestion, and allow a patient to breathe freely again. Return home after an outpatient procedure, 1 overnight stay to their families, and to live long and healthy lives. So the device comprises 3 different elements. The first is the implant itself, and here you see the implant being deployed into the left side of the heart. And then, so the second part is the delivery system that does that. And then finally, there is the power management, closed loop control, and wireless recharging system. The overarching plan extends to an early feasibility study, but first we have to get to an acute first-in-human trial, and the first phase of that is to achieve preclinical design freeze, and that's why we're here. We're looking for investment to help us achieve preclinical design freeze. There's plenty of evidence to demonstrate the efficacy of this device through bench tests and animal tests, all of which showed reduction in left atrial pressure by 10 millimeters of mercury. That is 3 times the target of 3 to 5 millimeters of mercury, left atrial pressure reduction. The device is very protected by by many IP or patent applications, including the most recent one being around an innovative driveline technique to minimize the size of the device in the left ventricle. The leadership team comprises myself, the inventor, Dr. Amber Hamid, his postdoc, Andrew Malone. This is a mix of clinical, engineering, scientific, and entrepreneurial experience and expertise. We're very fortunate to be supported by an extensive number of clinical advisors, including Professor Javed Butler, a worldwide HFpEF clinical research expert, and Dr. Aditi Nayak, an internationally recognized mechanical circulatory support and heart failure transplant clinician who's with us here tonight. So please talk to Aditi if you want to find any more information from a clinical point of view. They're both at Baylor Scott right here in Dallas. Thank you very much for your attention this evening, and I look forward to any questions afterwards.
Well, I've got good news. I am the last one, so you guys are almost ready to be done. So my name is Dr. Roy Stillwell. I am the CEO and co-founder of Nearwave, and we're working to monitor breast cancer therapy. I'll talk to you about how we're going to do that. So our story starts with my co-founder, Tom O'Sullivan. Tom here is, chatting. His wife at a really young age had breast cancer, diagnosed and is a survivor. Went through a number of treatments, and the treatment was really brutal. My mother's also a breast cancer survivor, so we kind of know this space and have gone through this. And essentially the chemotherapy that they were undertaking, they had to stop a number of times because it was so toxic, and weren't sure if it was working well. And that turns out that's pretty common. About 30% of women don't respond at all, essentially, to their primary chemotherapy. For the 300,000 patients every year in the United States that are undergoing invasive breast cancer. So, typically we do images. So you've probably seen X-ray. We do X-ray mammography generally for screening, and we also use MRIs, generally for doing imaging, but typically before surgery. But we can't do that kind of imaging very often. MRIs use toxic contrast agents, and can't do X-rays, all that often. And so we developed technology called Nearwave. So we have a device and a bunch of software. So this is actually a working device where we can tell in about a week if a chemotherapy or hormonal therapy is working rather than waiting 6 months to find out. So really early time period. And the way we do that, we use AI and some light. We look at the metabolic changes in tumors. So this is actually from an actual patient undergoing chemotherapy. You can see the tumor bright red in that, that right breast. And as they undergo chemotherapy, this patient responds really well. So this is great. This is what we would love to see. This is called a pathologic complete response. That doesn't happen, as often as we'd like, of course. And so we're developing technology around this. So typically, this is what we might see if a patient was undergoing therapy. We weren't seeing much of a change. So you don't see much change between those images there. And so what that allows us to do then is move to new therapies if there's some available. There's hundreds of them available. Or if there are none, we can just get directly to surgery, saving 12 to 18 weeks of toxic chemotherapy. So we're also building a really cool platform that we look at monitoring between patients. So imagine if you're undergoing treatment, we're not seeing a response, we're in a rural clinic somewhere, we can compare that response to other folks around the country. So let's say you're at a fancy center in NSK, New York, or MD Anderson here in Texas. We can show, hey, there's some drug trials that might work for you that work for these other patients. So really powerful platform. I think this is where the technology is the most useful. So it gives us like an accumulating advantage in comparing this technology to others, where we're building large training models and training these technologies and growing that network in order to better help oncologists around the country. So our model is really simple. It's about $12,000 a year for the service. It's a software as a service platform, and there's some hardware that goes along with that. We try to sign 3-year contracts, and we do about $80 a scan and reimbursement is what it's looking like. So we do about 5 or 6 of those. It's kind of on the order of an ultrasound, diagnostic in that kind of price point. So where are we? We've done a lot of clinical studies already, and we're already revenue generating. So there's a number of institutions that are already using this technology in their hospitals for pilot studies. And I've got a long list of folks that want to use them. There's about 30 other institutions, about $1 million in ARR that are interested in doing this, basically to grow the team because we can't manage that many pilots. We've already talked to the FDA and have a really clear pathway as well. So they totally agree with our what's called a 510K fast track pathway for this technology, and already have validated these studies in a number of studies around the country. So specifically in these institutions that we're showing here, about 85 to 90% accuracy. So it's on the order of mammography is the level of accuracy already for this technology. It's pretty cool. So we have an awesome team, a bunch of engineers. I'm a PhD in electrical engineering and work in biophotonics. That's light interacting in tissue. My co-founder is the same, and we have a number of experts in medical device development and folks that have worked for large institutions and multiple exits in the medical device and distribution field. So a lot of good experts in the space. We're also backed by some of the best accelerators and funds in the country, Y Combinator, for example, and Health Wildcatters, obviously, and a number of other VCs in our first pre-seed round. So this is what our pathway looks like. It's a SaaS sort of growth model. So this is all backed by actual numbers from actual statistics in hospitals. So you can see where we are now. We'll do our first indication by the end of next year, and we'll do multiple indications as we go. This market has a lot of space. There are a lot of cool things we can do with it. We're looking at about $100 million in ARR in about 7 years. So that's a $1 billion unicorn-style company here because we're on software that goes along with the hardware. So 3.5 billion year TAM. So very large market. We work with oncologists, medical and surgical, as well as some additional indications in the OBGYN and primary care space. We actually differentiate between benign and malignant tumors as well. So a lot of legs on this particular technology. Worldwide, it's about a $42 billion a year total addressable market. So a column here, maybe a little too much on the slide, but so we're in the first column there, and there's other companies that are doing this kind of thing. They look at functional imaging, metabolic information in the tumors using light. But there's other people that are doing this from other aspects. So MRIs, for example, people doing biopsies with DNA, looking at DNA. That's a little more invasive, and as I said, MRIs are really expensive, so we think we're the best in class in this space. And raising a couple $1 million, we've already got about $1 million of that circled, and looking to accelerate our sales, as well as FDA clearance and ISO certification. So we think this is going to be the standard of care in about 5 years, and would love to talk to you if you're interested in that journey with us. Thank you.
I wasn't gonna not have my walk-up. Now that we've figured it out finally, so one round of applause for Lindsay. We've never had this happen. I mean, it worked perfectly the first time, and now our whole speaker system is fried for unknown reason. And so that's why all of our entrepreneurs had to do the second round now without the microphones. And the music didn't work, so this goes up Lindsay's phone to our Sonos. It makes us look like $1 million. So it's great to have a team that can jump into it, and 11 entrepreneurs who can deliver a pitch no matter what happens. I would be remiss because it's an annual tradition to call out my daughter over here. It was a lot more fun when she was a teenager because she'd squirm right then, but now that she's older, she rolls with it so much better. So family support is important. And my wife is watching from home, so hi. Other than that, really, the bar is open. Thank you all for coming. Thank you for your support of health innovation right here in Dallas. As you can see, it comes from all over the world, but we can help them here, make it better. Any of you have connections, know someone that can make a difference in each of these startups. So thanks for being here. Thanks for your support. Get a drink and talk to those guys.